Welcome to another episode of Bugs, Drugs, and Genomes. This is Krista, and I'm here with
Ella. Hello.
Hello, Ella. And I'm so glad to be back for another episode of this podcast as we dive into another fascinating aspect of AMR, global health, and capacity strengthening. Today, we're diving into the world of policy. We're going to speak with the head of our research group, Professor Rene Hendriksen, about how important it is to share data and how it can be used to inform policy and public health decisions.
Thank you, Krista, for inviting me. I look forward for this discussion.
Nice to have you here, Rene. Before we dive into today's topic, could you briefly just introduce yourself and tell us a little bit about your background and your work with the GLOCAP group?
Sure. So I think I've been here for more than 30 years or so, working with global capacity building in an antibiotic-resistant context. And I started in another research group, and then basically everything just evolved, and now we are close to 25 people in our research group working on global capacity building for AMR surveillance.
Great. So to start out off on the topic, can you tell us a little bit about why sharing data across countries and institutions is critical in the fight against AMR?
Sure. So if we really want to do something about the emergence of antibiotic resistance, we need to share data. And not only within one country, but also regions and, of course, also globally. That's basically fundamental if you want to solve the problem.
Great. So can you give us some examples of how shared data has helped detect outbreaks or influenced a public health intervention, informed a policy decision in your experience?
Yes, of course. So basically this happens every day, more or less. So there's multiple examples, but it's not something that are often communicated in a wider scientific community. We were lately in one European member state where they had observed some persisting Klebsiella pneumonia in the hospital settings, and basically because of whole genome sequencing, they were able to identify that this was basically persisting, and but they didn't really know how to take actions, both political actions, but also actions to sort of condemn and control and prevent it.
And so what happened there?
So basically they asked us to help in a European Union reference laboratory context with also the State and Sim Institute in Denmark and the OCAS developing lab. And we visit the member state where they have invited also folks from their local CDCs and prevention control units, etc., where we explained them what the data showed, and then how to basically take action and try to prevent it.
Mm-hmm. When you're thinking about researchers sharing data across borders or across institutions, so what kind of challenges are faced there?
I think the major ones are probably related to trust. So if you have worked a lot and a lot of time or spent a lot of time, I would say, on a project and generated a lot of data, some of the analysis might be costly. Then just sharing that data to somebody else that potentially use or misuse that data, that can be a challenge and basically a barrier for sharing that data. Yeah. But there's of course other barriers for sharing data other than just the lack of trust. It could also be, and I guess it goes along the same, but being selfish. You have found something that are really novel, and then you just keep it to yourself until you have published it. But there's of course also a lot of legislation around it that can be difficult if you have less insight into it. There's the NAGOA protocol that you need to sign to protect your specimen. There's also a material transfer agreement that normally lawyers would draft. And if you don't have access to that, it also, make it cumbersome.
Yeah, for sure.
This is Ella jumping in here for a quick comment, Rene. This reminds me of something that you say, or I've heard you say often, that AMR doesn't respect borders, or there's no country boundaries to the problem of AMR. So that sounds like a real challenge. If people aren't sharing data, it's hard to effectively address this problem that affects everyone everywhere.
Exactly. I think that goes quite well with the issue that if you don't share them, you would never be able to solve the problem because it's all interlinked.
Yeah, exactly.
Yeah.
So how about data from AMR surveillance? How does that transfer into real-world policy challenges?
So we have, at least from a Danish point of view, been working with antimicrobial surveillance since the launch of DanMap. I think it's more than 25 years ago. And it's basically in the recognition that you need to have a surveillance or monitoring to pick up signals or problems. That's basically where you identify them. And then, of course, you need to trust the data. So again, you can easily maybe submit data to surveillance systems. But if you can't really trust the data, then you might take the wrong decisions. So that's where also an external quality assurance scheme or proficiency scheme is vital, because it basically allows you to assess labs' proficiency if they are able to generate reliable data. And that means that if you have that in place and you have a laboratory or laboratories to submit data to a surveillance system, then you can identify trends over time. You can identify outbreaks. There's a lot of things you can see from surveillance. And then you, of course, need to analyze that data, and you need to take action. So basically translate it into actions. That can be public health actions. It could be a lot of things. But that's basically how it works in surveillance, that you generate data, you analyze it, you interpret, and then you take action.
That's great. So how can we, when we're thinking about young scientists, like our colleague Ella in the room here with us, how can young scientists contribute to improving global data sharing practices?
That is, of course, to be aware of the need for sharing data and understand how vital that is. And then, of course, to advocate for open science and basically follow the FAIR principles of findable, accessible, interoperational, and reusable data. So in their sort of communicating their science, that's pretty important. And then, of course, to engage in collaboration in the broadest sense, because if you work alone, then you're probably not going anywhere with your science. So you need to be open for collaboration, basically.
That's great. So if we do this right, if we get data sharing right, what does the future of AMR surveillance look like?
I think that we would be in a better position to basically identify concerns, challenges early on. And then if you apply whole genome sequencing or methodology with the same resolution, you also be able to basically pick up it both sooner and quicker and all of the good things around it. So that's basically what we look into with the future, with engaging and maybe transfer to a genomic-based surveillance. So I think we are in the middle of a paradigm shift of that, going from conventional microbiology to genomic-based. And with genomics, you have just immense added value, and that would enable you to do everything both better and faster and quicker. And
final question. So if you could change one thing about how the world handles AMR data today, what would it be?
Yeah, that's a good question. I think that that if we handle the data, I think if we could make sure that we all trust the data, I think that that might be what we need, because I think there's a lot of data, probably fragmented. So we need definitely a way of having standardized, harmonized, and reliable data, because that's the essence of basically taking action.
Sounds good. Thank you so much, Rene. And thank you, Ella, for joining us as well for this really nice conversation about policy and AMR. We see so many nice connections here that we need to keep in mind.
Thank you, Krista and Ella, for having me.
Of course. We'll have you back.
Yeah. Thank you.
So we're about ready to wrap up this episode, but before we go, as always, we have a quick quiz for our lovely listeners.
So today's question is, what does the acronym FAIR stand for in the FAIR principles? F stands for findable, A is accessible, I is interoperable, and R is reusable.
That was a tough one today, Ella, but thank you all for tuning in for another episode of Bugs, Drugs, and Genomes. Stay tuned for our upcoming episodes where we continue to delve into the research group's work, AMR in policy, practice, interesting career insights. Don't miss it. We'll see you next time.